Now, last Wednesday, the cabinet, in an act of mercy and compassion, let me make it abundantly clear that my cabinet is a compassionate cabinet. My government is a compassionate government, and it always be a compassionate government because at
This
the end of the day,
is
we are
Antigua
people centered,
Newsroom.
and we know that we always have to act in the best interest of the people, even in the best interest of the ignorant. So we took a decision to adjust our vaccination mandates. So, for example, those that apply to workers, we took a decision that as of December 1st, 2021, that those unvaccinated persons who operate in workspaces or departments or institutions that have achieved herd immunity, that is at least 80% vaccinations, that they could return to work from December 1st, 2021, because we wanted to earn some money for Christmas. We want nobody to go into Christmas hungry. And the reality is, a number of them would have paid the price already, been home for about 2 months without pay. And whereas the mandates were a call to duty and designed to increase the rate of vaccination so that we can achieve herd immunity as soon as possible, they were not designed to create any sustaining hardships to anyone. And if we were to, let's say, continue those measures for an extended period, then they'll
This
become
is Antigua
counterproductive
Newsroom.
because having people out of work for an extended period of time and they're still not vaccinated, then there's no value in that. So, as a government and a responsive government, and this is perhaps where the wisdom comes into play, we had to time the implementation of the mandates, and we equally had to recognize when the time had come to adjust the mandates. And even though we have not ended them, at some point the mandates will come to an end. And that is where the discretion will come in from time to time. And that is where the people of Antigua and Barbuda will see and feel the compassion of the government and certainly the wisdom of the government to bring these issues to an end or to adjust accordingly. So again, those unvaccinated workers, they can return from December 1st, 2021 with the proviso that the department, the institution, or the workplace in which they operate would have achieved herd immunity. That is, at least 80% of the staff would have been vaccinated. And in addition, they are required to test at least twice monthly.
This is Antigua
Now, as
Newsroom.
I said before, the salient thinking behind this decision was to ensure that people can go back to work. For instance, public sector workers, they work from January 1st to January 15th. When we pay them on January 15th, we want to make sure, or when we pay public sector workers on January 15th, we want to make sure that everyone has a check going into Christmas. We want every single person, every family to enjoy a good Christmas. We want to go into 2022 as a harmonious nation with all hands on deck in order to facilitate a strong recovery. In fact, we will be declaring 2022 as a year of revival. And when I say revival, it's about, literally recovering the fortunes of our country as we seek to restore strong economic growth and sustain improvement in the living standards of our people. I mean, many individuals would have seen a degradation in their living standards, and we want to make sure we reverse that as quickly as possible, because ultimately our role as a government is to make sure that we continue to improve the living standards of the people. Now, through no fault of theirs or any fault of the government, COVID would have decimated our economy, put a number of them out of work. And we want to be in a position to have a vibrant economy next year and to put them back to work. And in order to grow the country's economy, we need the contribution of every person. So if you're going to have 20% of the workforce, languishing, it will impact on productivity. And remember, we made a determination from long ago that we're not going into 2022 limping. We intend to restore strong
This
growth and
is
development
Antigua
within this country,
Newsroom.
and we need every hand to the plow. And that is why we had to flex and to allow for these individuals to return with the understanding that they get tested at least twice monthly. Now, for public sector workers, the government will cover the cost of testing for at least what, a month and a half until
Okay, we
December
had a
31st,
bit of a glitch
2020.
there. We had a bit of a glitch there, so we didn't hear exactly the time frame that you said. So could you just repeat for us if you don't mind, sir?
Right. So I was saying that the government of Antigua and Barbuda will cover the cost of the testing for all public sector workers until December 31st, 2021. Thereafter, they'll be required to pay for their own testing costs. And one of the reasons why we decided to cover the cost of the tests for public sector workers, I mean, those who are out of work, they may not have the monies to go to a doctor to pay $150 or $200 to get tested. So we had to take all that into consideration. I know there are many who are frowning, saying that they should test, that they should pay for their tests. Well, we say no. Now, in the private sector, it's a different ballgame. The private sector employee, if his employer refuses to cover the costs, and we're not putting any burden on the employer to pay for those tests, then it may well be the responsibility of the employee in the private sector to pay for his own testing, his or her own testing. So again, we leave that entirely to the private sector employer to determine whether or not the employer will cover the cost of the testing, even for a limited period, or if they will make it the responsibility of the private sector worker to cover his or her own costs. So again, government will cover the cost for public sector workers for them to get tested, and will do so until December 31st, 2021. Now, the school mandate, it was always intended to be extremely short, and it was actually relaxed. I remember 2 Wednesdays ago, when the time for the students to get vaccinated had expired, the Director of Education came to the cabinet and he said to us that even though the time had expired, that we should not proceed to have these children out of school because, we have an obligation to educate them. And we did. We understood that. We understood the conflict as well. But we took a decision that if we kept them out of school for a week to force the vaccination process, that will not undermine their education in any way. So we had to stand our ground, and that is precisely what we did. And within that last week, no exaggeration, we had at least 2,500 to 3,000 students who became vaccinated. The following day, the Thursday, we had about 800 and something, then it reduced to about 700, over 700 for the following 2 days. So we were able to get an additional 3,000 secondary school students vaccinated, and that is how we have now achieved herd immunity within our secondary schools. So the health officials would have confirmed that we have over 6,000 plus students, secondary school students who are vaccinated. And of the total of 7,000 plus, it represents about 85% of the secondary school students who are vaccinated, which means that herd immunity has been achieved in our secondary school community. However, there are some, I shouldn't say however, but there are some specific schools, especially public schools, that are below the 80% vaccination threshold to achieve herd immunity. So we have agreed with health officials that measures will be put in place or instituted to get herd immunity in those schools as soon as possible. So some specific measures are being put in place in order to drive that process. And children who are unvaccinated, they too must get tested twice monthly in order to enter the school premises or the school plant. And the government has agreed that, we will continue to cover those costs of testing indefinitely. So the school children, they're not working and they're not unvaccinated because they made that, let's say, ill-informed decision. I mean, they are innocent individuals, and we have to, go the extra mile to protect them and to ensure that they can get tested without incurring any cost. So the government will cover the cost of testing for school children. And, you spoke earlier about the issue of full-time education. Mm-hmm. One of the reasons why we pressed to get herd immunity within our secondary schools is because we felt that the part-time learning that is taking place would result in a significant amount of educational regression, that our secondary school students will be left behind. And it means too that those who be sitting exams next year, even those who at State College doing Cape exams. I mean, if they're going to be doing 2 or 3 days a week, clearly it's going to undermine the capacity to reach the maximum potential and to get the maximum amount of subjects. Why should we continue to operate in this situation which they can only go to school on a part-time basis? What we're doing is that we're undermining their education. Now, we all know that unless we got herd immunity within the schools community, the secondary schools community, that they would not have been able to return to face-to-face at least on a daily basis. So our aspiration now is to have them all go back to school next January, assuming the epidemiological position allows for it. If it remains stable as it is now, COVID cases are down, hospitalizations and deaths, then we will allow them to all go back to school in January face-to-face on a daily basis so that they can get the full contact time and so that our students can be competitive. So.